Okay, continuing in the Master of Risk Adjustment program, we have looked at a number of the coding processes and guidelines, etc. It is now time to talk about something critically important. Okay. One thing about risk adjustment, by and large, it does not involve any procedure coding. Risk adjustment is based, again, on the health status of beneficiaries, okay? Health status would be diagnoses, okay? Procedures are what are on claims, and that's what the risk adjustment, the risk-adjusted premiums, the revenue that these carriers get from the risk adjustment is designed to provide them with the revenue for the expected and appropriate and the volume of treatment protocols, interventions, etc., that would be submitted on claims. But again, risk adjustment is about the revenue for these carriers to provide healthcare benefits. And that is, again, fully determined by the healthcare status of the beneficiaries. And healthcare status is a snapshot of their health conditions, and conditions are diagnosis codes. So since the focus is on diagnosis coding, you must be very proficient in diagnosis coding. And so, aside from simply being proficient in ICD-10-CM and being familiar with the official guidelines of coding and reporting, there is another element to diagnosis coding that cannot be overlooked and must be adhered to. And this is called ICD-10-CM AHA Coding Clinic. And that's what we're going to talk about today. So we're going to talk about ICD-10-CM AHA Coding Clinic, and AHA stands for American Hospital Association, which you'll be very familiar with by the end of this module, and what every coder must know. So we're going to talk about the history of Coding Clinic, the authority of Coding Clinic structure, resources, challenges presented to coders by Coding Clinic, and what you don't know may hurt you. Okay. And along with this module in the learning system will be a practice exercise. So the history of Coding Clinic. Coding Clinic was created through a written agreement known as a Memorandum of Understanding between the American Hospital Association, or AHA, and the Centers for Disease Control and Prevention, the CDC, in 1963. Okay, so this actually predates Medicare, if you've been following along, Medicare and Medicaid, to serve as a clearinghouse for issues on ICD-10-CM. Of course, it wasn't ICD-10 then, but we've updated this for this terminology for this module. Obviously, previously ICD-9, and I believe it might have even been ICD-8 at that point. But AHA works with the CDC and CMS to assist with maintaining system integrity and for recommendations on revisions or modifications to the classification system. They also work together to develop education. So, it needs to be said. I mean, the volume of codes, the volume of information in ICD-10, and it's CM and PCS. But we're not dealing with PCS in risk adjustment. So, if I narrow my narrative to diagnosis codes, ICD-10-CM, it's only because we're not dealing with PCS, but Coding Clinic has authority over PCS as well. But with the volume of codes and code descriptors and instructions in ICD-10-CM. The old adage in life, nothing is perfect. Okay. And so, there is inevitably going to be room for clarification. There are inevitably going to be ambiguities or even possibly errors. There was an instance years ago with the diagnosis of kwashiorkor and how it was indexed and referenced in at the time ICD-9, and so errors or lapses or gaps or ambiguities can occur in such a code set with such volume. So there must be a provision for clarification, updates, revisions, modifications, etc. And that is what Coding Clinic does. The authority of Coding Clinic, the 4 organizations, both public and private sector, in conjunction with the Department of Health and Human Services, or HHS, make up the cooperating parties for ICD-10-CM. The American Hospital Association, AHA, the American Health Information Management Association, AHIMA, CMS, and NCHS. Okay, these are the 4 cooperating parties for ICD-10-CM. And if you go to your official guidelines for coding and reporting, this is in the preamble or the introduction to each version of the official guidelines and coding and reporting. Furthermore, this is from the 2008 Risk Adjustment Data Technical Assistance for Medicare Advantage Organizations Participant Guide, or the 2008 Participant Guide, as we have come to affectionately know it, to assist users of ICD-9-CM, and I've inserted now ICD-10-CM, in interpreting and clarifying the guidelines, as well as publishing updated codes and applications. The AHA Central Office on ICD-9-CM publishes quarterly official code advice in Coding Clinic for ICD-9-CM. The Coding Clinic for ICD-9-CM is the approved resource to update and clarify the use of ICD-9-CM. Okay, so I didn't change the ICD-9 in each mention here. I did it in the parenthetical after the first mention because in 2008 it was ICD-9. Okay, you will see on subsequent slides that it is, of course, now ICD-10. Okay, so if we take a look, you'll see in the participant guide the documentation resources, and the second one is ICD-9 Coding Clinic guidelines. So don't be mistaken. Coding Clinic has standing authoritative binding representation here. Okay, so it's not optional. Coding Clinic for ICD-10-CM and ICD-10-PCS is the quarterly newsletter published by the American Hospital Association's Central Office on ICD-10-CM and ICD-10-PCS. The advice provided in Coding Clinic is the result of a formal cooperative effort between the American Hospital Association, the American Health Information Management Association, AHIMA, the Centers for Disease Control and Prevention, CDC, and the National Center for Health Statistics, NCHS, and the Centers for Medicare and Medicaid Services, or CMS. In addition to these organizations, the editorial advisory board consists of an expert panel of physicians representing the American Medical Association, the American College of Surgeons, the American Academy of Pediatrics, and the American College of Physicians, as well as coding professionals representing healthcare facilities. Published since 1984, Coding Clinic brings the latest official coding information to coding professionals, auditors, third-party payers, government agencies, and consultants who are interested in and dedicated to improving the accuracy and uniformity of medical coding. CMS's affirmation of the Coding Clinic as the official source of coding information is noted in the Federal Register, Volume 74, number 165, Thursday, August 27, 2009. Okay, so let's read that again if you need to. Official source, okay? The official guidelines for coding and reporting developed by the 4 cooperating parties are a set of rules that have been developed to accompany and complement the official conventions and instructions provided within ICD-10-CM and ICD-10-PCS. The instructions and conventions of the classification take precedence over guidelines. The guidelines provide additional instruction. Adherence to these guidelines when assigning ICD-10 diagnosis and procedure codes is required under the Health Insurance Portability and Accountability Act, or HIPAA. The Coding Clinic is to be used as an official resource when the classification and the guidelines do not provide direction. So we're going to go back to, again, the 2008 participant guide, okay, and section 6.3, to assist users of ICD-9-CM in interpreting and clarifying the guidelines, as well as publishing updated codes and applications. The AHA Central Office on ICD-9-CM publishes quarterly official code advice in the Coding Clinic for ICD-9-CM. The Coding Clinic for ICD-9-CM is the approved resource to update and clarify the use of, and I need to move my menu here, ICD-9-CM. The small volumes, typically about 20 pages, include clarifications of previous advice and guidelines or new information on specific diagnosis, coding practice by means of articles and a question and answer section. Okay, and we'll show you an example of this momentarily. So, again, it's published quarterly. Changes, clarifications, updates. Many publishers of ICD-10 include the Coding Clinic references beneath the codes in the tabular section in color to distinguish it from other information. So you will see here for this code, D6481, anemia due to anti-neoplastic chemotherapy, and you will see this reference, AHA 2014, 4Q, 22. Okay. Now that 22 is not always not every publisher goes as far as noting the page number. That's the page number. But when you see AHA, and other publishers may say AHACC. Some of them say CC, which is ill-advised because that could also be comorbid condition. But when you are in the tabular list and you see anything, AHA, AHACC, CC, if you see a date with a number and a Q, okay, and then you may even see a page number, you know that this is a Coding Clinic reference. And you cannot possibly be assured that you are coding correctly if you are not heeding required official Coding Clinic guidance, okay? So this code has Coding Clinic guidance, okay? It was issued in 2014, the 4th quarter, and it was on page 22. So you should be, and that DEF, that has nothing to do, that's a separate entry, okay? That has nothing to do with you will not see typically anything more than the reference to coding clinic, the year, the quarter, and perhaps a page number. So anything after that is a new paragraph. Okay. So on the right-hand side is what a coding clinic looks like. If anybody's been in a hospital inpatient coding department, you may have seen these floating around. Typically, they have them in a binder, or they have them, electronically accessible. But this is what the hard copy looks like. Okay. And it's kind of got this table of contents for the different topics included in that particular version. Okay. So this would be the fourth quarter 2022. Okay. And let's see if we see page 22. Anemia due to anti-neoplastic therapy. So if we look, I don't see, let's see, chemotherapy. So it's not evident here. It's not evident here in the table of contents, but you have the page number, so you would go to the page number because it could have started on another page or what have you. You'll see coding advice and new code assignments contained in this issue effective with discharges October 1st, 2022. Okay. So even though this was, let's see, so final quarter of 2022 would have been October, November, December, right? So it gives you the effective date of the guidance as well. Okay. So that is what a coding clinic looks like. And so when you see this in your ICD-10 book, okay, you cannot be assured that you are coding correctly if you do not know what that reference says. If you don't go and look up that coding clinic, okay? And again, it's required by law. Okay, so it's worth stressing. AHA has 5 main roles: serve the members of AHA on a national level, to maintain uniformity of the system and its guidelines for all healthcare settings, identifying and resolving coding and classification issues for members with expert advice as a clearinghouse for coding information for its members and other users of clinical data, representation of its members by recommending revisions to both CMS and the CDC who maintain the code set in order to stay up to date and current with trends in use, provide educational materials to help keep providers and coders well trained and informed on how to properly capture data, stay involved on the use and interpretation of data and development of standards in inpatient, outpatient, home health, and rehabilitation at the heart of the system and those who use it. In 2001, AHA began providing assistance on HCPCS, Healthcare Common Procedure Coding System, okay, with the development of AHA Central Office on HCPCS. This office began issuing advice on HCPCS Level 1 CPT and some Level 2 National HCPCS as it relates to issues of institutional providers. In 2005, they entered into an agreement with CMS to provide clearinghouse services for HCPCS, as with the ICD-9 and ICD-10. Under this agreement, they provide advice regarding CPT codes for hospital settings and Level 2 HCPCS in the following categories: A codes for ambulance services and radiopharmaceuticals, C codes, G codes, J codes, and Q codes for hospitals, physicians, and other healthcare providers who will bill Medicare, except for codes Q0136 to Q0181. So if you are familiar with HCPCS, this list here is not all the HCPCS codes. These are the ones that AHA will offer guidance on. AHA also has a set standard for services they will not address. and that is inquiries from physician providers related to CPT-4, which should be addressed directly to the AMA. And just a side note here, AMA produces a similar offering for CPT, current procedural terminology, and that is CPT assistant. Okay, so what Coding Clinic is to diagnosis codes and ICD-10 procedure codes, CPT assistant is to the AMA's current procedural terminology code set. Questions regarding A codes and Q codes. Q0136 to Q0181, except as above ambulance and radiopharmaceuticals, which should be referred to the Statistical Analysis Durable Medical Equipment Regional Carriers, or SADMERCs, or SADMERCs. you may have seen DMERCs, so I say SADMERCs. Remaining level 2 HIPAA related to DME, durable medical equipment, prosthetics, orthotics, or other supplies should go to the regional carriers for DME or DMERCs, or the DME Medicare Administrative Contractors MACs. Okay, and so you'll probably see these more in LCDs, local coverage determinations. Okay, so anything related to durable medical equipment, prosthetics, orthotics, or other supplies, you should be looking to your LCDs for the appropriate MAC or DMAC or DMERC, I'm sorry, for any of those questions. Questions can be submitted to AHA through their website at HTTP. I'm pretty sure that this is HTTPS // www.codingclinicadvisor.com /. Appropriate code assignment is more important now than ever. Although I could make the argument it's always been important. It should never have been less important. Okay, but certainly because this program here is talking about risk adjustment, which is totally dependent on complete and accurate code assignment, the critical nature of it can't be understated. A coder must possess a greater understanding of anatomy, terminology, payer billing policies, coding guidelines, and coding clinic in order to arrive at the most specific code available for both accurate and optimal reimbursement, but also for reporting purposes. Reimbursement is kind of the end result of accurate and precise and complete coding. So just as with CPT, HCPCS, and ICD-10 coding manuals and other resources required for job performance, you may have to also purchase Coding Clinic if it's not provided to you, okay? Ignoring this authorized resource can result in unacceptable work performance and even job loss. And this is especially true of inpatient and risk adjustment coding, where the impact on finance and reimbursement is the greatest. It is ultimately the coder's responsibility to maintain all necessary professional resources. So, maybe you have access to, maybe you're provided access to coding resources. Maybe you have online access to procedure codes, to diagnosis codes, etc. And a lot of those, online accesses do have Coding Clinic, although oftentimes they are a modular add-on, and so you want to make sure that whoever has provided your access, has opted for that. Okay, but it is just as you must each year. You should be purchasing your coding manuals, ICD-10, CPT, and HCPCS. This if it's not provided to you, it's still your responsibility to have your tools, and this is a necessary tool of the trade. Applying past issues of AHA Coding Clinic for ICD-9-CM to ICD-10. The Central Office on ICD-10-CM and ICD-10-PCS has received numerous requests to advise users on how past issues of AHA Coding Clinic for ICD-9-CM are to be utilized in the ICD-10 environment. In general, clinical information and information on documentation best practices published in Coding Clinic were not unique to ICD-9-CM and remain applicable for ICD-10-CM with some caveats. For example, Coding Clinic may still be useful to understand clinical clues when applying the guideline regarding not coding separately signs or symptoms that are integral to a condition. Users may continue to use that information as clues, not clinical criteria. As far as previously published advice on documentation is concerned, documentation issues would generally not be unique to ICD-9-CM, and so long as there is nothing new published in Coding Clinic for ICD-10-CM and ICD-10-PCS to replace it, the advice would still stand. And let me just stop right there and I want to restate this. If you see a Coding Clinic from 2002, and now it's 2023, that was 21 years ago. If there is nothing to replace or eliminate that Coding Clinic guidance, do not look at the date and assume that it is, obsolete. Okay, that is the biggest misconception that you could make. Okay. Previously published ICD-9-CM advice that is still relevant and applicable to ICD-10 will continue to be republished in Coding Clinic for ICD-10-CM and PCS. As with the application of any of the coding advice published in Coding Clinic, the information needs to be reviewed carefully for similarities and differences on a case-by-case basis. Care must be exercised as the codes may have changed. Such change could be related to new codes, new combination codes, code revisions, a change in non-essential modifiers, or other instructional note. So just to paraphrase that, the information in the tabular may have changed, or in the index, but specifically in the tabular where most of the code descriptors and instructions are, you have to be careful. They could have changed. Not necessarily making the guidance obsolete, but you must view each on a case-by-case basis. This is particularly true as ICD-10-CM has many new combination codes that were not available in ICD-9-CM. For example, previous Coding Clinic for ICD-9-CM advice has indicated that hypoxia is not inherent in chronic obstructive pulmonary disease, or COPD, and it could be coded separately. Coders should not assume this advice inevitably applies to ICD-10-CM. The correct approach when coding with ICD-10-CM is to review the index entries for COPD and determine whether or not there is a combination code for COPD with hypoxia, verify the code in the tabular list, and review any instructional notes. The coder should then determine whether to code the hypoxia separately and not automatically assume that a separate code should be assigned. So one of the things that we hear a lot is cost challenges presented to coders by Coding Clinic. And it's not meant to sound cold, callous, or unsympathetic, but sorry. And what I mean by that is, there are resources that you need to be a professional medical coder. Okay. A carpenter needs a hammer, a saw, a screwdriver, what have you. An electrician needs their tools. Every occupation has their tools. Okay, and if they're not, if your perspective is, well, if they're not provided to me, I'm not doing it. Well, then that is your prerogative, but it's not an excuse. So while coders and professionals are responsible for application of the guidance of AHA Coding Clinic, it can be costly if you work in an environment where it is not provided to you by your employer. Most encoders offer Coding Clinic as a supplement at an additional price. It can also be purchased directly from AHA. If you work from home, this may be a question you ask before accepting a position. Do they provide access, or is there a person to whom you can direct these types of questions who has such access? Or are you expected to purchase it on your own? Okay. And this is the pricing from AHA. Single user, non-member is, so if you're going to buy it on your own, it would be $375. Okay. And that's if you were going to just do ICD-10. You wouldn't need HIPAA, not for risk adjustment. So if you are if you're coding beyond risk adjustment and dealing with procedures, et cetera, then you may need to look at that. But for risk adjustment, okay, it would be $375 or a non-member. Below that is the member pricing, which if I recall correctly, if you add a membership, the membership fee plus $245, it comes out to be more. Okay, so unless you have other reasons to be a member of AHA, you should expect to spend $375. Okay, and it's not cheap. Okay. Now, I do also want to say that, where most encoders offer Coding Clinic as a supplement at additional price, very few are going to offer it at a pass-through price, meaning they're going to add a markup on top of it. And so it will likely be more expensive to get it through any other source than AHA. And so, I'm just being, frugal here. I'm just being transparent. I'm not trying to, influence anybody in any, to any which way, just being transparent that the lowest possible price would likely be getting it directly from AHA. Any other place, you're going to be paying a markup. So here's D64.9. Okay, and this is what it would look like in a typical encoder. Now, obviously, this is how it looks in Find a Code. Okay, there's many different types of encoders out there, and so it wouldn't necessarily look the same. But here, you have a code, and there's below it, there's different options, additional code information, documentation guidelines, etc., articles and newsletters, and it lets you know that there is a Coding Clinic reference. Okay. And so each time you look up a code in this particular coding resource, it's going to tell you that there's a Coding Clinic reference in 2018 and 2017. There's a lot of also different information available at the AHA Coding Clinic website. Of course, the Coding Clinic subscription tab. There's webinars, there's education resources, and quizzes. Okay, and so it's worth a look to explore beyond just accessing Coding Clinic for appropriate use. But there are also some good learning options and other amenities available. So for details on obtaining AHA Coding Clinic, and this is not a commercial, this is a reference material. If you do not have, if this is the first you've heard of a coding clinic or you've never known where to get coding clinic, that's the point of this. You can go to https:// www.codingclinicadvisor.com/subscriptions. Okay, and that's how you can get details on accessing this necessary resource. So just to point out here, okay, that your professional toolbox, okay, if you are used to having 3 tools in your toolbox, that's not necessarily complete. And actually, I have 4 here. It could be really 5 if you procedure coding and need a CPT assistant. Okay, but it's not. It's just not logical that you would have 3/4 of the tools that are necessary to do your job. Okay, and to eliminate one at your own, at your own discretion. Well, that's you're doing that exactly that at your own discretion, and not to be sinister, but at your own peril as well. Okay, this is what your toolbox should include. If you don't have all the tools in your toolbox, then you cannot possibly be coding completely and accurately with certainty. And so that is our training on AHA Coding Clinic, and you should, you should be advised at least and knowledgeable. So we'll see you in the next module, folks.